Thank you.
Good morning, everyone. Welcome to the House Healthcare Committee. It's Friday, February 24th. And this morning we have, on very short notice, she changed her schedule for us. So thank you, Susan. We have Susan Ridson from, I hope I said that right, from Health First, who is coming to us, as many people did yesterday, with a budget request for Medicaid rates. So Susan, if you'll introduce yourself for the record and then go on with your testimony.
So thank you for the opportunity to speak today. My name is Susan Ridson. I'm the Executive Director of Vermont Health First. We're an independent practice association. We represent 62 specialty care and primary care practices located throughout 10 counties in Vermont. And so I know you heard a lot of testimony yesterday, and I'm just going to build upon that. I promise no new acronyms.
Thank you.
Yeah, you had a lot coming at you yesterday for sure.
Yeah, we did.
So our ask is the same as Jessa's, and that is for a 3.8% inflationary adjustment to be added to the 2022 RBR-VS physician fee schedule. And that's not a new acronym, but just to refresh the group, that is the fee schedule that Alicia showed you all that would be decreasing $380,000 if aligned to the 2023 Medicare rates. So we are looking for an adjustment to the 2022 RBR-VS so that there would be a little bit of an upward movement. And the reason for that is, as you heard yesterday, prices are increasing for practices. The CPI has increased 6.5%, the consumer price index, and certainly our practices are feeling it in fuel costs, supplies, but most of all in staff, trying to recruit staff. And independent practices are particularly strained in this regard for a number of reasons. First, their margins tend to be the thinnest of all the practice types that you'll see in the system. But also, they have no other resources, no other sources of revenue, as I talked to this committee about a few weeks ago, other than payer reimbursement. So that's reimbursement from Medicare, Medicaid, and commercial payers. There's no grants to draw upon. There's no 340B programs. It's just payer reimbursement. So if those don't move to match expenses, then it's a real struggle. And what ends up happening is practices can't compete for staff, and they're really struggling to meet the needs of the community and having to work longer and longer hours just to make it work. We also have some additional challenges in that other, like a nonprofit hospital and FQHC, if a clinician comes to work for one of them and they can get loan forgiveness. That same thing does not apply to an independent practice. So, it's very hard to recruit under those circumstances. So we've seen these pressures play out over the last 5 years. We've lost 12 practices, more than half of those were primary care practices. This is largely due to under reimbursement. We've lost, our rural practices more quickly because those tend to be higher percentages of Medicaid. So Medicaid, while we do appreciate, their goal to be a predictable payer, they have been under reimbursing for some time, and it's, shows up. So we're asking for an increase in the reimbursement. And we're really hoping to prevent more closures. And why should you care? Well, because when these independent practices close, keep in mind that independent practices are some of the highest value practices in our system. There's ample evidence that they provide very high quality care at a low cost. The very types of practices we want to be preserving if we want a system that is affordable and accessible When these practices go out of business, what that ends up doing is restricting access. So, the practice is no longer there for their patients. Or if the clinicians, stay in business, or not stay in business, but continue working and don't retire or move out of state or whatever, they would go work at a hospital or an FQHC perhaps. And the cost of care in those sites is higher than in the independent practice. So the result is it drives up the cost of care throughout the system for both Vermonters and just the system in general. So by sustainably reimbursing these practices, in part by increasing the Medicaid rates, you can help keep these practices in business and just continue to get access to affordable care.
Great. Thank you, Susan. So I just have a clarifying question. So if we increase that professional services rate that Jessup and Vermont Medical Society talked about yesterday, that increases for their providers, and it also increases for your providers, the independent providers. There's not a separate code that we would have to increase the 3.8% for.
No.
Okay.
My understanding is that would apply.
Okay. Great.
To both. Yep.
Any other questions for Susan?
I have a clarifying question. And I know it's not on your ask, but can you explain, because I don't really understand this, like recruiting and loan forgiveness? Is there something with the loan repayment programs that I know we've set up a couple. Why would?
So independents are able to, go ahead, sorry.
No, just why would an independent practice not be able to?
It's a good question.
Not be able to utilize that.
They are able to take advantage of the loan repayment program and that recruitment and retention fund. Those are absolutely available to independent clinicians. It's more loan forgiveness, which is a federal thing. So, to be fair, the state doesn't have a whole lot of sway on this. It's a federal thing that if you go and work, at a nonprofit, you can get your loan forgiven.
Okay, great.
It just does not apply to an independent practice, unfortunately.
So that's not something we can fix
No,
here?
it's not.
Okay, that's fine.
It's just something to recognize that,
Yeah.
It further strains independent's ability to recruit clinicians.
Yeah. Anyone else have any?
Now I'm a little confused. Independent physicians' practices cannot use the loan forgiveness program?
No, they cannot. Loan forgiveness is different than loan repayment, though. Just to be clear, loan forgiveness, is where you actually don't have to pay your loan back.
Okay.
If you work for a certain amount of time, I think it's 2 years maybe,
Yeah.
at a nonprofit.
Okay, but you can get, on a year-to-year basis, you can get the payment for the individual, right? You can
Yes,
get
well,
that.
clinicians who work in an independent practice can apply for the loan repayment program.
Yeah.
And if they qualify, they can definitely get money to help them repay their loan. It's just not a forgiveness program.
Yeah. Just repays the loan.
Yeah.
Okay.
Anyone else? Great. Thank you, Susan, for coming in early and for walking us through this. Have a wonderful weekend.
You too. Thanks. I appreciate your time.
Yep. Thanks, everyone. And